Right now to the coronavirus here in Connecticut, and many of you have been sending us your questions about the COVID vaccine, so thank you so much for that. And joining me with some answers right now is Dr. Keith Grant, the Senior System Director of Infection Prevention at Hartford HealthCare. Dr. Grant, thank you so much for being with us. I believe we're having a little trouble hearing you, Dr. Grant. Hopefully we do get you back. First off, I wanted to ask you, now we do hear you.
Thank you for having me. Sorry, my phone's off.
Oh, no problem. You were one of the first healthcare workers vaccinated this week, so I first wanted to ask you, how are you feeling right now?
I feel fine. One of the side effects of the vaccine is, is some pain at the site of the vaccine. So I definitely do have that. So very mild ache at the site of the vaccine. So, but other than that, no other symptoms, no symptoms at all.
All right, that is great to hear. So let's get to our viewer questions. Doreen from Orange wants to know, does the vaccine prevent a person from contracting COVID completely, or does it just make the symptoms less severe?
That's a very good question. So the vaccine is 95% effective in preventing you from actually getting the virus itself. And this is based on the studies that was conducted by Pfizer. And Moderna's vaccine that we expect to be going through EUA very soon, that vaccine is about 94.1% effective. So in preventing the actual virus itself.
Okay, good to know. Now, Kate from Waterbury has a question. She wants to know, once an elderly person gets the vaccine, how long should their family members wait before seeing them? We've all been really wanting to see our family. So I think this question really is exemplary of how a lot of us are feeling.
Yeah, so that's a good question too. One of the things that we've said a few times, still ensuring that we're putting the appropriate processes in place. So ensuring you're wearing your mask. But if the question is at what point do we expect that 95% coverage to come in, it's about 7 to 14 days after the second dose is administered. So at that point, I would, coordinate with your healthcare providers, coordinate with whatever long-term care your loved one is at, or if their loved one's at home, make sure you're communicating with their long-term care providers about the risk itself, but it should give them significant coverage.
All right. Well, you are always a wealth of information, and we are so happy that you and so many healthcare workers have been able to receive those first doses. Thank you again for your insight and for everything you and your colleagues have been doing really all year long.
Absolutely. Have a good night. Thank you.
You as well. And we know many of you still have questions about the coronavirus vaccine, so make sure you send them our way on the Channel 3 app, and then join us tomorrow night at 7 for a special show with Hartford HealthCare, all focused on answering your questions.
Yes, tomorrow night at 7. Make some hot cocoa and watch that special after the snowstorm.